Hi, and welcome to episode number 5 of GP podcast by Nadia. Today I'm making this video on my way to work because on Saturdays I usually start work at 10 a.m. Today's video is going to be a short one because long ones can be a bit hectic for you to listen to and for me to make. Our topic today is medication summary management or medication management, and I will divide my podcast on medication management in two parts. One is what should or can a GP do for maintaining an effective medication summary for all of his patients, and number two would be what can a patient do to ensure that his or her medications are managed very efficiently. So if we talk about a GP, I'll tell you about myself as what I do about maintaining an effective medication summary for each one of my patients. As you guys know that some patients can just be on no medications at all, some patients are on a couple, and some patients might have an extensive medication list that has to be managed very effectively and efficiently. So what happens is that when a patient, my regular patient, walks in my room, apart from other questionings, I initially, in the initial parts of the consult, what I do is I make sure that I open their medication summary and ask them one by one what medications are they taking, and because of course there is a medication summary from the last visit as well, so I'll go through each medication one by one and will ask them, are they still taking them, do they know what is their indication, why are they taking these medications, what are they for. I'll also make sure that the brand names and the actual names of the medication are mentioned in the medication summary so that patients don't get confused, because one medication that has a pharmaceutical name can have a few different brand names. Some of the brands are on PBS, some of the brands are private. So I will make sure that I mention both of them on my medication summary. Then what is the indication? What is the timing? Are they taking it in the morning, in the evening, or afternoon? Then what is the frequency? Is it once daily, or is it twice a day, thrice a day? And so dosage, timing, frequency, and indication. These are the four things. So what is the dose as well? So dosage, frequency, how many times a day, and timing, morning, evening, or afternoon or night, and what is the indication, what are they taking this medication for. So I make sure that this is all mentioned in the medication summary. Also they understand, the patients understand. So that is the medication summary initially GP and patients can go through. Then at the end of the consultation, again we'll go through the same medication summary and make sure that any changes made during that specific consultation are incorporated into that medication summary, and we'll go through it once again and see what are the changes made, if there is any new medication that we have introduced in this consultation that the patient has to take, if there are any changes in the dosages, if there are any changes in the timings, if there are any other changes, or if we have removed a medication completely. Then that medication summary is also divided into two sections, I'll make sure. So one is regular medications. What medications are there that a patient has to take regularly, and what medications are there that are taken as needed. So for example, some painkillers are there that are as needed, or anti-anxiety medications like Valium, for example, if somebody is on, as needed, or constipation relief stuff which patients are on as needed. So as needed medications are divided separately, and then the regular medications are charted on the medication summary separately. Then another important thing in the medication summary is the vitamins, minerals, or any supplements that patients are taking. So we have to make sure, both as a patient and as a GP, that those supplements, vitamins, herbs, minerals are also regarded as medications and are treated as medications. We know what we are taking them for, what we are taking magnesium for, what we are taking calcium for, what we are taking vitamin D for, vitamin B12 for, iron for. Of course, one of the indications is their deficiency in the body, but the other indications could be, so for example, magnesium can be taken for muscular cramps. Vitamin D and calcium are taken even though they could be normal in the body, but they are taken for bone strengthening. So and vitamin D is also linked to increased energy levels, and also linked to depression if they are not taken, like if they are towards the lower normal in the body and they are not taken regularly. So these are the things that every GP and patient should regard as medications also, along with their dosage, their timing, their frequency. And because some of the vitamins, so for example, if somebody is on energy drinks or is somebody taking a lot of multivitamins, their B6 can be in the danger zone. It can be high. Even calcium can go high in the body. B12 can go high in the body if somebody is on IM supplements. So, and these vitamins, when they are deficient, they will cause other issues, but when they are high in the body, they can cause other issues. For example, excess of vitamin B6 can cause peripheral neuropathy. So pins and needles and tingling and all of that. So we have to be vigilant about vitamins as well. So this is what a GP should do: a medication summary in the beginning, as to review what medications patient is taking, and then in the end again, and then print 2 copies of the medication summary, one for the patient, him or herself. I usually ask my patients to put a copy on the fridge for them to, or at any spot where they can remind themselves to take them. And 1 copy for the pharmacist, whichever pharmacist they are going to. So we make sure that pharmacists and patients have the same copy, and pharmacists are in line with us, knowing that, you know, these medications patient is on, and this is their dosage, timing, frequency, and indication. So this is what we have to make sure as a GP, that medication summary, in my view, is actually the most important part of any patient's management. So we have to very efficiently make it. Thank you so much.